Asthma, what is it anyway, and why is it so important to diagnose early? Before getting into the importance of asthma, we need to explore a bit more about what it is. Asthma is a chronic lung disease that inflames and narrows the airways in the lungs, or bronchial tubes. This means that it releases air during an asthma attack in extreme difficulty. Because it is chronic, it means that someone who has asthma will live with it every day. While a person affected with asthma may not have a flare up every day, they are always an asthmatic. Most asthma attacks are a result of an asthma trigger such as dust, chemicals, or pet dander. Since asthma largely involves the narrowing of airways, if it goes undiagnosed as a child, it can cause irreversible damage. Here are some signs that doctors and parents can keep an eye out for possible hints towards diagnosing asthma: wheezing, eczema, dry skin, allergies. If asthma is suspected, one of the most common tests would be performed is spirometry. What is spirometry? Spirometry is a simple plastic device that a patient breathes into, which helps determine the amount of air that is inhaled, the amount of air that is exhaled, and how quickly the air is exhaled from the lungs. These numbers help a doctor determine whether or not a patient has asthma. It can also determine other lung diseases as well. One of the most common reasons for emergency room visits in children are asthma attacks. Infections are a main trigger in asthma attacks in children. To avoid these from happening, it is suggested that a child be tested for allergies so that they can avoid those allergens. If they cannot be avoided, allergy medication and vaccinations are suggested. Of course, a parent would not know to do this if they were unaware that their children were asthmatics. As you can possibly guess, again, it is very important to keep track of possible signs. Although asthma is chronic, it is treatable. In order for asthma to be treatable, it must be diagnosed. If asthma is not diagnosed, it could potentially be fatal. It is very important that one keeps up with all of their doctor appointments as well as making an appointment if something is wrong. What are some of the treatments used for asthma? 1. Quick relief medicine. These are taken at the first sign of asthma attacks. They include short-acting inhalers. Patients with exercise-induced asthma often recommended these types of inhalers to use if their symptoms act up during a workout. Quick relief medicines are absolutely essential, but they do not control the airway inflammation. Here is what does. Long-term asthma medications taken daily to prevent attacks and curb symptoms. These medications are taken every day. Even if you do not have a symptom, the most effective long-term control medicine reduces airway inflammation and helps improve asthma control. While corticosteroids can be very helpful, there have been a lot of controversy regarding them. They can be very dangerous when not taken as prescribed. Such studies have suggested that the inhaled corticosteroids may slightly reduce the rate of growth in children, perhaps by 1 centimeter or less than half an inch per year. Of course, this can be a very scary thing for a parent to think about. However, this must be remembered. Any allergist prescribing cortisone steroids to treat a child with asthma will recommend the lowest effective dose of these drugs and will monitor the child's growth. The majority of people with asthma will take both long-acting medication and quick relief medication. A doctor will help to prescribe the best kinds and forms of treatment. While asthma can be very scary for both the parent/caregiver and the person suffering, it can be very manageable with taking medication exactly as prescribed and as often as prescribed, making certain to keep up with doctor visits as scheduled. Asthma does not have to be scary. If the steps needed to be taken are taken, the person with asthma can live a normal life and can do everything that others can do.